Upstate Transplant Services wants to work very closely with the hospitals in making the donation process go smoothly, not only for the donor family and our organization, but also for the hospital we're dealing with. We understand that you have a lot going on in your hospital, and this is one more thing you have to deal with. So we're here to try to make it easier for you.
Why do I have to call this immediate death as a referral?
What gives units the authority to look at my patient's charts?
Why do I have to give so many medications to a patient that's already dead?
Why does it take so long?
Why do I have to spend so much time on the phone when calling in a cardiac death referral?
This patient is old and sick. Why would you want his organs?
Why can't units take care of this patient?
We're still treating this patient. Why should we call units now?
Do only wealthy patients get transplants?
Is there a fee for the family?
I have live-in patients to take care of.
How it all started was back in 1998, the Routine Referral Act became a federal law. And what that stated was every hospital throughout the country has to pick an organ, tissue, and eye bank to call in all their brain and cardiac deaths. When there is a death, the nurses or the physicians would call in that death to the referral center, and the department would take down some basic information on this referral. They would take information, that would include probably name, medical record number, some history, medical history, medications the individual was taking, lab results, and then the donor screeners would actually determine eligibility. If that potential donor is eligible for donation, then at that point we would secure the individual at the hospital so that a funeral home wouldn't be able to come and pick the body up before we actually made that approach and given the opportunity to their loved one.
And we meet all the family's needs prior to having any conversations about donation, trying to find out where they are in the grief process, what do they understand about what has clinically just happened to their loved one, help them understand the concept of brain death, and help them understand the donation process. And then once that is all absorbed by the family, then we do whatever we can to honor that wish of donation by finding recipients, either locally or nationally.
When a donor becomes available for transplantation of tissues or organs, the first thing we do is we test for infectious diseases that could be transmitted potentially through the organ or tissue transplant. Then in the case of organ transplantation, we examine all of the individuals that are candidates for organ transplantation locally. We test them with this particular donor for compatibility. And essentially what we do is we do the test tube transplant prior to the surgical transplant. We will test those recipients with those potential donors and select that recipient has the greatest probability and possibility of success.
Whether someone's able to donate their organs or not isn't necessarily dependent on their age. It all comes down to the function of the organ. What units will do is evaluate the patient and the organ function. We will then offer the organs to the transplant centers, and it's at the discretion of the transplant surgeon whether or not the organs are transplantable, not necessarily the age.
Know that even if they can't be a donor to somebody for a transplant, we also do a lot of research donations. And when you donate for research, there's a real possibility that your tissues could help medical researchers come up with a cure for something like cancer or diabetes. And then you would have the ability to help whole generations of people in the future.
There's often a time when a patient looks like things are going the wrong way and you're saying, should we or shouldn't we call someone to take a look at them for brain death? Should we or shouldn't we call units to let them know we think we're at that moment? And sometimes you have the feeling of, I'm not sure enough yet, maybe I should wait to call. I have never had units complain, you let us know too soon. I've never had units say, too bad they didn't die. Again, I've never seen anyone involved in this whole process who cannot celebrate not having to harvest an organ for the individual who's actually going to live, or who minds being called early rather than later, because the earlier everyone involved in an organ donation knows that the moment is coming, the better prepared we are, the better quality of the donated organ, and the better chance for that organ to survive in the recipient, all because we took that extra moment to think about it and call early.
As much as units would like to be able to be hands-on and assist the nursing staff in taking care of potential organ donors, unfortunately the liability for the hospital of having someone not an employee of the hospital taking care of patients is unacceptable. So what we will do is we will assist with donor management through our medical director, our critical care intensivist, and the transplant surgeons to advise the nursing staff and the medical staff in the hospital of the appropriate management for the patient.
But I think that sometimes as healthcare professionals we think to ourselves, dead is dead, what's the rush? But the fact of the matter is you can be brain dead and still be able to preserve heart function, circulation, all of which is critical to continue to supply organs that potentially can be used for donation, such as the kidneys. If you don't contact the people who can help you with organ donation in a timely fashion with as much lead time as possible, then you deprive all of us of the opportunity to have an organ that can potentially be donated to another individual.
Once a patient is consented for organ donation, the staff at Upstate New York Transplant Services will put the information on DonorNet, which is part of United Network of Organ Sharing, which is the federally designated organization to oversee all of donation in the country. The list we run from there will indicate who the #1 person on the list to receive the organs are. We contact the transplant centers, give them all the information about the donor, and they make the decision whether or not they'll accept the organ for their recipients. We do that for all the organs that are transplanted, and then we coordinate the recovery of the organs.
That we still have a very meaningful moment ahead, and that is for the person whose life that we are not able to save, to be able to help that family give the gift of life.
Even though a patient is clinically dead, the function of their organs still need to be maintained. The result of everything that the nurses do at the bedside taking care of that potential donor has a direct effect on the potential recipients of those organs. So in essence, the nurses aren't taking care of one dead patient, they're taking care of them in up to 7 live patients. All hospitals receive federal funding. In order to do that, there's conditions of participation that the federal government demands the hospitals maintain. One of the conditions of participation is that a hospital have a memorandum of agreement with an organ procurement organization, tissue bank, and eye bank. Upstate New York Transplant Services is the organ procurement organization in Western New York. The memorandum of agreement that the hospital signs with Upstate New York Transplant gives us the authority to look at any patient's chart who has potential for organ, eye, or tissue donation.
Basically, without the nurses giving us that medical information and that small snapshot of that admission from this patient, we wouldn't be able to perform our job. So much information relies upon these nurses that have worked personally with the individual or the patient or the potential donor, that we would not be able to read between the lines. There's a lot of things written in medical charts, but the nurses right now are the key factor. They can tell us what's going on with that patient because they've spent so much time treating this individual.
Now, once the family consents to organ donation and they've met brain death criteria, all fees associated with the donation are paid for by Upstate New York Transplant Services. There should never be any fee to the family once a decision to donate has been made. Once a patient is declared brain dead, the process can take a minimum of 6 hours, sometimes 24 hours just for the declaration. What we do in the meantime is work with the medical staff and the nursing staff to make sure that every transplantable organ is functioning at the best it possibly can. So we do a lot of donor management goals, a lot of orders to try to maintain the patient and to make sure it has the best possible function so the family's gift for donation could have the best results possible. When we put a patient on United Network of Organ Sharing and see who the #1 patient on the list is, the only thing that we know at Upstate New York Transplant Services is the recipient's name, social security number, and blood type. We have no idea what the financial background, whether the person's insured or not, or whether the patient, what the recipient's sex is. It's all completely anonymous.
I take care of all the aftercare for our donor families. We plan events that honor their loved ones. We send them letters telling them about the recipients, where they live, their hobbies, a little bit about their family life. We follow up with phone calls.
And we got a letter from units saying that 55 people benefited from the donation of his organs and his veins and his bones and his bone marrow, and which made us feel a little better about it. We got a call if we would like to meet the young man that got my son's heart on national TV. And he was about the same age as my son. And he's become like a extended part of my family, like another son. He doesn't take the place of my original son, but he's become like another son.
We're able to reconnect with some of these families and sometimes let them know the people that have received organs, the lives that have been changed or saved, and what a blessing they have been to somebody else, and that their loved one did not die in vain, but the gift of life goes on, and that people are blessed eternally.
I believe their role is critical because at the time of the death or the imminent death, the family is turning to them for the options. So to educate them and have them supportive of organ and tissue donation at that time or even prior to the death occurring, maybe when they're doing living wills or end-of-life care decisions, they play an instrumental role in those decisions.
It's a very difficult situation when you're called into a situation where death is imminent, and we have a small window of opportunity to try to get to know the people and let the people know us. And so it calls on a complete support staff, not only just professionals that know the medical terminology, but our donor moms and parents and people that have donated in the past and have a little bit more than empathy because they have actually sat where some of these people are sitting now, and they can help them through something that's very difficult that they've never done before. You got to imagine the fact that we meet people on a regular basis that have never been here before. They've never seen this. They've heard about it, read about it, but they've never experienced it for themselves. This is new.
I am so grateful to that staff for taking the initiative to ask the question. It's a hard thing for hospital workers to do.